Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today with a show called Big Butts, No Lies. It's a given, right? That I'm going to be talking about innovation and patient safety when it comes to BBLs. So my guest today, you guys are going to love. And I have Dr. Alex Earle and his wife, who's also the COO of his practice at Pure Plastic Surgery in Miami. These two are going to give us exactly what we want to know about innovation and patient safety. Hi, guys. How are you?
Hi. Good. How are you doing?
I'm doing good. I'm so happy to have you two on, Dr. Earle. And I'm sorry, I don't remember your name, and I want to remember.
Michele.
Michele.
Yes. Michele.
Okay, Michele. I'm so happy to have you on, too. I know you're really the one running the show back there.
That's right.
Okay, Dr. Earle, I'm so happy to have you on the show. The topic for our episode is innovation and patient safety. And I know you're the president of WAGS, so who would be better than talking to us today about innovation and patient safety when it comes to BBLs? So my first question for you is the BBL safe? And when did you start using ultrasound technology?
Great. So, first of all, thank you so much for having us on. We're really excited about being here today. We've looked at, a lot of your podcasts, so it's really a great opportunity for us as well. And regarding the BBL, so that's the question that's on everyone's mind, right? So you look at, what happens, what you see in social media, you look what happens actually in the news as well. Even your kind of your regular news on TV, and everyone's talking about how unsafe this procedure is, and there's been some fatalities and things of that nature. So to answer your question in the short form, is the BBL safe? The short answer would be yes, when it's done by the right person with the right tools, okay? So it's a yes, it can be safe, but what I would like to say, it's a very unforgiving type of surgery, meaning that if you don't have the experience, if you don't know, what you're doing, if you don't know the anatomy, if you're not using, tools to help you with this, then things can go wrong very, very quickly. The reason for that is because, as opposed to many of the other muscles in the body, the gluteal muscle has some fairly large veins right underneath there. And if these veins are injured and then fat gets into these veins, they can very quickly travel to the lungs and cause what's called a pulmonary fat embolism. And a pulmonary fat embolism, especially a large one, what we call a macro pulmonary fat embolism, can be immediately fatal. So it's originally a blind procedure, meaning that you don't really see exactly where you're placing the fat. And you need to put it in that safe space that's between the skin and the muscle. There are no large vessels there. So that is a safe space. And in order to do that, what I've incorporated since 2019 is the use of ultrasound imaging technology. Okay. So now ultrasounds are they're very easy. They're very mobile. They're actually in there, the cost of this technology has come down quite significantly, such that it's easy to have an ultrasound in your operating room and move it from room to room. And with this device, I can now turn the blind procedure into one where I can actually see exactly where that cannula is. And I can make sure that it's in that safe space between the skin and the muscle. And therefore, the risk of any sort of fat embolism or anything like that is extremely, extremely low.
I love hearing that. I really love hearing that, especially because I feel like the BBL has gotten such a bad rap. And now with safety at the forefront, what you said about the procedure, it used to be you're going in blind, but now you can actually see what plane you're in to make sure that you're not causing any damage while you're in there.
That's exactly right.
Can you tell us how exactly you do it? How does this work? Tell me.
Yeah, so it's actually it's pretty cool, and some if you go into some of our IDs and whatnot, you'll see me actually doing it. But the ultrasound device is actually it's handheld. It's very small because now it all fits in the palm of your hand essentially. And what it does is that it can transmits a signal through Wi-Fi to an iPad. So you can get a regular, just any iPad really, and you have the small handheld ultrasound machine. And with that, I place it over the buttock area, and I can see the different layers of the buttocks. So, of course, near the top, you'll have your skin. Then you have what we call the subcutaneous fat layer, which is that what's between the skin and the muscle, which is your safe space. And then you see this very thick white line over the muscle. That's a covering that covers it. It's called fascia. It's very obvious when you do it on the ultrasound. So you can tell exactly where that cannula is. So I use the image, I place my cannula, I know that I'm in that safe spot, and then I keep the image on there as I'm injecting the fat. I can see it go into that safe space. You see like this beautiful cloud forming, and it looks like a cloud almost. And what it does is it pushes the skin up, it pushes the muscle down, and expands that space, which is what we want to do, right? That's why you're coming to have more projection, more hips. And so we're expanding that space with the fat, and you can see it all in real time.
That's wonderful. That's so futuristic.
If we were talking about this 30 years ago, the machine would be hundreds of thousands of dollars and it'd be huge and bulky and be very difficult to do. But that's not the case today. So it's something that any plastic surgeon can acquire. It does require training, though, right? You can't just buy it. And so that's why we actually have a training course here for that.
I'd love to hear more. With the show, what I like to do is educate the girls, educate them. So when they go out looking for these procedures, so when they go out and they are having consultations, they know what questions to ask and they can know when it's a red flag and when it's a green flag. So if you could educate us as much as possible on this specific topic, I'd be so happy.
Yeah, of course. So
what questions should they be asking?
I also go into this what are the most important things when it comes down to how are you going to choose your surgeon, right? And what a lot of people may think is the first thing that pops to mind is actually the least important thing, and that's price. That's the last thing you want to think about, okay? Because we're talking about real surgery here, right? We're talking about your life on the line, which becomes my responsibility or the surgeon's responsibility, right? So price is the last thing that they need to be concerned about. But you want to ask about, first of all, you want to ask about their experience, their education, and their training. Okay. Board certification is also very, very important. Experience is, how many BBLs have they done? When they did some of these studies back in 2017, when they were having more fatalities, that study demonstrated that there was a higher rate of fatalities in surgeons that had only done less than 50 procedures, right? So you want to go to someone who's done a lot of these procedures. Like I myself have done over 3,000 BBLs and over 2,000 of them ultrasound guided. All right, you got board certification. You do want to look at the before and afters. Every surgeon has their own style, and so you want to match, what you're looking for to that surgeon's style. I think that's also, very important because it's much harder to try to get a surgeon to switch their style and accommodate you. So you kind of figure out their style as well, and then it doesn't stop with the surgeon. You have to look at the facility. For example, here in Florida, you have 3 levels in terms of the OR certification. The baseline level is the Department of Health, which means that you have to have that because if you don't have that, you can't operate. It's illegal to operate. So that's baseline. And then you have one that's called Quad ASF. And then the highest level is what we call Joint Commission, or JCO for short. Joint Commission is the same place that goes into all the big hospital centers, centered by like you go to Jackson Memorial Hospital, Baptist. The Joint Commission is the one that certifies those ORs. So it's the highest level of safety. Like they look at everything. And Michele can tell you a little bit more about that. Let me just say that that's the type of certification that we have here. And that's a question that should be asked.
They set the standards really, really high, Joint Commission. So we prepare for months before the first inspection. And then obviously after that, it's on a regular basis, maintaining that level of safety in all of our processes. So from screening our staff to training our staff, to them providing the right materials, the right supplies, to establishing protocols and processes that are, standardized and that are certified by the Joint Commission. So, I mean, there's a lot that goes on behind the scenes that patients don't really see. And that's what the Joint Commission like puts a stamp of approval is because you're really following all of these processes and protocols to the T. I mean, they're very, very, very strict when it comes to, inspecting the practice and making sure that everything is followed. So yeah, we had an exciting April. We had our latest accreditation and we passed with flying colors. So it was really fun. The surveyor actually, she came in. She looked really tough at the beginning. We were all very scared. She went around and did all ask questions of everybody. And then at the end of the day, I mean, I almost brought tears to my eyes because she was like, you guys have a really special place here. Your staff is very communicative. You can feel that they appreciate working here. And that really meant a lot to me because everybody worked so hard to make sure that we follow these standards and that we keep the highest level for our patients and for us too, because we're proud of the work that we do. So it was a special experience, honestly.
I love to hear that. That's wonderful. She probably said, okay, this place gets an A+.
That's right. Yeah.
So you guys know I have every surgeon fill out the podcast prep sheet and I get to know a little bit more about their practice, about what their favorite procedures are, what they like to do and how they take care of their patients. So something that stood out to me on your podcast prep sheet was that you made a note about patient vetting. And I would love to hear more about that.
Yeah. So, and that is also a lot where a lot of these processes come in. But here's the thing, as a surgeon, right, it is our responsibility to make sure that the patient is ready and for surgery, and it's safe for them to undergo, because we are using general anesthesia and we're doing it in what's called an office-based or outpatient surgery setting, meaning that the patient needs to be able to have surgery and go home afterwards, right? So that means that it has to be a patient that is generally in good health. So we ask a lot of questions. There's a fairly detailed questionnaire. We ask them about their past medical history, past surgical history, what medications they're on, etc. And then we also make sure that there's a medical clearance for 100% of our patients to be medically cleared by their primary care provider. On top of that, we ask for multiple labs and EKGs. Again, 100% of patients labs and EKGs. And then, then we have certain criteria for other things. For example, if you're a breast patient, you're over 40 years old, we have to do a mammogram and things of that nature. If you have thyroid issues, then we have a thyroid. It's okay to have, some other medical issues as long as they are completely controlled. So say you have high blood pressure, but it's controlled, you have your medical clearance, then we can move forward. Say you have diabetes, it's controlled, yes. However, if we check a lab, for example, for diabetes, there's one called the hemoglobin A1C, and that's high, and we're not going to be doing surgery because you're not controlled at this time, okay? So we go through all of those different processes to make sure that, it is safe. And then we also have a lot of limits. For example, BMI. My BMI limit is fairly strict in a sense. Okay, my max BMI is 30 for any surgery, really. And the reason for that is because there's multiple studies that have shown that as the BMI goes higher, the risk of complications goes up. Okay, such as, blood clots, heart issues, problems with the wounds healing, et cetera, et cetera. So I do put a limit on BMI. Certain surgeries, I put a limit on age. Okay. So for BBL, which can be a surgery that can be tough on the body, I put a limit at age 50 for that procedure.
Yeah, and I think also throughout our process, we want to make sure that the patient is successful right at the end of their journey, right? That they not only do they have excellent results and obviously go safely home, but that, throughout that process, they're really, they're having the best experience possible. So for that, like the patient also has to come in with realistic expectations and also be committed to the journey because it is a long process. Even though surgery is, like one day, that is really not the journey. The journey starts, 30, 45 days before surgery. When you're prepping for surgery, it's the post-op, committing to your massages, committing to making sure that you eat well, that you exercise. So some that, I think that what comes into the vetting part as well, and this is less clinical, is when we realize that a patient is not committed to the journey and they're not really, ready to make that change in their lives, right? When they're not ready to eat healthy and exercise and do all the massages, and they're planning on partying in South Beach 5 days after surgery, which we've heard, they're not a good fit for this practice because, we really want the patients to be successful. So we really want them to be happy at the end of the day. And we know that for that, yes, of course, it takes an excellent surgeon. We have right here, but also, the commitment from the patient to make sure that they take care of themselves and they go through the entire journey.
That's wonderful. I love hearing and seeing on all of what you guys sent to me. Your main message for our episode was safety and what you're doing in your practice to make sure that you're taking care of your patients with the best care. And I think that's something really beautiful for my girls to hear because they're all going into surgery. And of course, there's nerves and there's some normal anxiety, but a lot of that anxiety is, oh my God, is it safe? Am I doing the right thing? Because of everything they see online, everything they see in the news, even just recently, somebody passed away from a surgery and it creates this anxiety. So I love hearing how practices, especially you guys at Pure, what steps you're taking to ensure your patient safety. And if sometimes that means turning them away, it means turning them away.
Certainly. And I think another piece of that puzzle is education, patient education. So obviously things are a lot scarier when you don't know what's going on. And there's a lot more room for error, just not doing what you're supposed to be doing if you don't know what to expect. So I think a lot of what we do here, and for those that may have seen me on my Instagram, the main purpose that I use social media, is for patient education. We do some fun stuff too, right? I want people to get to know us, but really the main goal for that is to educate the patients about the journey, educate them about the procedure, educate about what are the potential complications that can happen, what we can do to try to minimize those complications, and then, of course, how you have to take care of yourself afterwards to really kind of have the best long-term outcome.
Dr. Earle, I know you're in Miami, so you're in the capital of BBLs. Are you seeing a lot of reductions?
So, actually, that's an interesting question because it's something that what we're seeing more and more of right now. And for a couple of reasons. One is that just styles change, right? You look at different styles throughout the years, what women aspire to or men or whoever really in the 70s is not the same as the 80s, et cetera, et cetera. So overall styles have changed, but also, I think back a few years ago, people were just going for like really high volumes, lots of projection, lots of, large, what we call lats and hips, looks that I would call them surgical looks. They don't look so natural. And so then now, people are coming back to try to either kind of reshape or reduce a lot of that, because I think before also not a lot of thought was given also by the surgeons of the patient's underlying frame and foundation. So you can't put a large buttock or very wide hips if the thighs are small, for example, right? And you see that, unfortunately today walking around and you're like, oh man, that just didn't go with her body. And it's not going to be a long lasting result. See that, right?
Like Cardi B says, you say it's real, but why don't the thighs match?
That's right. Exactly. Right. And you end up with an ant booty or diaper booty, sometimes they call it. And then that's the other thing. Gravity takes over, right? And so things start falling too soon. So we're seeing that a lot. And not all surgeons take these cases because honestly, they're very challenging cases. They can be very challenging. And so again, one thing that we have to talk about with patients is setting expectations, right? So something's been done, it doesn't, and we want to fix it, we want to make it better. And we certainly will make it better, but it may not go back to if nothing ever happened in the first place, right? So, but we've been doing more and more of those cases. I think it's actually, I'm very interested in doing them because I do like that challenge. And we just recently had a patient who had her first BBL. It was done elsewhere. It was done out of the country, actually. And she just was so unhappy for so many years. Didn't wear anything tight, always wearing baggy stuff because her hips just didn't match her body at all. They were wide, they were lumpy, they were bumpy. And so, I took on the case again, not an easy case. It actually took two surgeries, to be honest, to get her to where she's at today. But just last week or so, like after the second surgery, she looked at herself, and I mean, she was just like ecstatic, like so happy. She did this beautiful testimonial for us here in the office. And she was like, you gave me my life back. Like you changed my life back. And it was really incredible. And that's why I think these cases can be very, very rewarding. So they're challenging, but I like that. And so I think we're going to see more and more of that coming up.
I agree. I get message DMs of women who are looking for surgeons for reductions. And sometimes it's a little difficult because they've been over liposuctioned and nobody wants to take on their cases. And I'm trying to help them find a surgeon. Now I'm going to send them to you, but I'm trying to help them find a surgeon and they keep getting turned down. And it's just so heartbreaking for the patient when they're like, I'll pay anything, whatever it takes, I'll pay it, just fix me. And like, there's nobody that's willing to take on the case. It's heartbreaking. So I'm happy I have somebody to send them to now.
Yeah. And I'm certainly happy to take a look. I mean, we do take these on a case by case basis because the key is like, I have to be fairly, certain myself that I can make it better, right? The last thing we want to do is make anything worse. So I really look into these cases with a lot of detail. But if I do feel like, hey, I think we can help, certainly happy to do so.
That's wonderful. Even I'll look at your pictures makes them feel better than an immediate no.
Right. Exactly.
Okay. So tell me, besides BBLs, what kind of procedures do you enjoy doing the most?
So I call myself kind of a body plastic surgeon. What does that mean? So I do body related surgery, so body and breast. So here at BBL is certainly number one in terms of numbers, but mommy makeover is a close number two. So what I call mommy makeover is a combination of a breast surgery and a tummy tuck. So we do a lot of mommy makeover. Sometimes we add on the arms. We call that the trifecta perfecta when we add the arm lift or brachioplasty to that. So that's definitely number two. And then, tummy tucks, liposuction, and any breast procedure. That's really like most of what we do.
Let me ask you this question. So do you do combo tummy tuck BBL at the same time? No. Okay. Tell us.
No.
Tell us why.
No, I don't like the combiners. I really don't. So I don't do it. Part of it is because of the restrictions that we have here in Florida. So here in Florida, when you do a tummy tuck, you're restricted by the Department of Health to removing only 1 liter of fat via liposuction.
Okay.
Which is typically what I get in the flanks and waist. And so you really can't, do the rest of the lipo. And then you only have 1,000 cc's. So you have to split between the two sides, so only 500 cc's per side. So you're not really getting a great result from your BBL. That's reason number one. Number two is I think it's a longer surgery. It's tough to recover from a tummy tuck by itself. It's tough to recover from a BBL by itself. And now you're combining these two. So your risks are definitely going to go up. Risks of not only, potentials for fat embolism if you're not using ultrasound or whatnot, but also for what we call a PE, your regular blood clots, your DVTs and PEs, the risk for that goes up as well. So risk factor is higher, and then recovery is really, really tough, right? Because for the tummy tuck, you have to be on your back and you have to be kind of in that kind of flex position because you're going to feel real tight. And then for the BBL, ideally, you would be on your belly, not putting any pressure in the buttock or hips. So you can't do that. So you end up compromising the BBL again because you have to be on the buttock. And yes, you can have like your inflatables and your cutouts and things like that, but it's not ideal. So at the end of the day, you went in for more risk. And you're going to have less than ideal results for each of the surgeries with a tougher recovery. It's just not worth it. I don't think it makes any sense.
And after surgery, do you have your patients have lymphatic massages and get into compression? How long? What's your typical recommendation?
Yeah, so that's something that I think we've learned a lot in the U.S. over the last few years because our colleagues in Central and South America have been doing for a long time. But lymphatic massage is incredibly important, super, super important. And even that, it's been evolving for me. Like say 3-4 years ago, I'd say you need 10. Now the minimum is, absolute minimum is 20. I separate out in like 3 groups of 7. So the first 7 need to be daily. The next 7 are like every other day. And then the final 7 are weekly. So that gets you to about 21 massages in total. And that's the baseline. That's where you start. Some people require more. And then in terms of your compression, yeah, certainly the faja, you got to wear that the first 6 weeks, night and day with the foams inside. And then after that, after the first 6 weeks, you can scale down to 12 hours a day, but you're going to use that to at least 3 to 4 months.
We really want to empower our patients to be able to decide, how many more massages. So he sets a baseline, right? But then we educate our patients too in terms of, okay, now, like, am I developing a little bit of fibrosis? Like, do I need, like, is this area maybe a little bit more swollen than the other? So it's probably not smart to stop at 20, 21. I'm going to need maybe 30. So that's the kind of partnership that we want with the patients, so that it's not just, follow this list and that's it, but really, educate yourself, learn about the process, learn to pick up on the red flags so that then you're empowered to make decisions so that your results are the best for you. And that's something that we work really hard with our patients. So not only does, he provides obviously all the post-op instructions, but then our nurses are always available for calls and follow-ups. And we always ask to send pictures or see them in-house and really like just tweak the recovery process for that specific patient and making sure that patient can make their own decisions about, so it's a tricky question when you ask, about the massages, because it's like, yes, there is a minimum, but really the patient knows best. It's really the answer at the end of the day. After the minimum, right? You don't want to go below 21 or 2021.
That is really interesting. I've loved on this podcast, we've talked about how it's changed. Like it's just the recommendations, the industry, like it's just blended from other countries, what they're doing and how they're enhancing their results. I've had surgeons where they're like, do not touch anything for 4 weeks. And what I advocate on this show is when you're picking your surgeon, make sure that your post-op care aligns with what their recommendation is. So if your surgeon, if you have been doing all of this research and you've been listening to the show and you want to get lymphatic massages and you want to be in compression and you want all these things and you go to the surgeon that you're going to pick and they're like, nope, no massages, no faja, no boards, none of that. Then the patient is kind of like, oh, okay, so what should I do? This is when you have to find a surgeon that aligns with what you're looking for.
And also like in the style and everything that we just talked about. And because, it has to be a right fit, right? It has to be a partnership there. And then following up on that, I would say the last thing you want to do though is, go to a surgeon and then not do what they tell you, right? You want to avoid that from the get-go. So you definitely want to be with someone where you're going to follow all of their post-op instructions the way that they've done it based on their own experience and how they do.
Exactly. That I preach on this show, like your first decision, most important decision out of everything that you're going to choose is who's going to do your surgery. That's the most important choice, the most important decision, and the decision that should take you the longest to decide. Not first consultation, book and schedule. Do your research, make sure that you've seen at least 2 or 3 consultations to make sure that when you do pick your surgeon, you feel inside like, yes, this is the one.
That's right. Yeah, you do all that research beforehand, and then you have those consultations to see how the personalities fit, and that's kind of like the final step. But you definitely need to know, who they are, if they're board certified, what experience they have, what technology they're using, how they communicate with the patients, and all these things are super important.
One thing I want to ask you, Dr. Earle, is so you're the president of WAGS, right? So the World Association of Gluteal Surgeons. And with that, I know I was on the website earlier and y'all talk about ultrasound a lot. So Are you teaching other surgeons how to do this safely?
Yeah. So part of our mission in WAGS is to make this procedure safe, right? That's the mission, and that's why we've all joined it. And so we've therefore incorporated the use of ultrasound into kind of our philosophy of how to do this surgery. And of course, we have over 300 members, and not everyone comes in knowing how to use this technology. But because we are such proponents of it, we do have a training course that we provide. And of course, I'm the head trainer, if you will. Pure is the primary training center. So we train the other trainers. So they've come here. We've had about 6 or so courses already. We've trained about close to 30 people, which are now spread throughout the country so that they can then train people there. And that's how we work. We wanted to be able to provide this to as many surgeons as possible, right? If I just keep it to myself with the one center, that's not going to be able, we're not going to be able to do that. Yeah. So
doing it for the community.
It's a great course. Yeah. We 4 to 5 surgeons come in on a Saturday. Of course, they do some didactics, but then we actually go into the operating room, with a patient, and they watch me do that live, which is like the best, sort of training there. And then once we're done with that, then we'll come back, and I have some like models that we can put on the desk. It's like a mold, if you will, that looks like a buttock. And so I have them then use the ultrasound and play around with it so they can get used to how to use the technology. And then they'll get a certificate. But now we have a 3-part process in terms of actually earning the WAGS ultrasound BBL safety seal. So the first part is you do have to go through a didactic portion. It's online. There's about 14 important articles that need to be read. And then you go through a quiz, basically, questions and answers. Okay, that's part 1. And then part 2 is that you do the course either with myself or one of the other trainers that we now have throughout the country. And then part 3, which is one of the most important parts, is that you go back to your place, and then you have to do a video of you using the ultrasound, okay, and showing us exactly how you're doing it, so that we can then see it, make sure that you've learned everything you're supposed to learn, that you're doing it right. And if you pass all those steps, then you'll get the WAGS ultrasound BBL safety seal.
Is there a way for any of our listeners who are looking for a WAGS certified surgeon to find a list of surgeons that maybe somebody in California or somebody around the world, there's listeners all over the place, where they can find somebody near them?
They'll be able to go to the website and click on the membership, that based on like location. But that's, what you just said, though, is a great idea, because I don't think right now we have like a specific section for those that have earned the ultrasound safety seal. So that's a great thought there, because we definitely should put that up there. So just to make it easy, like these are the surgeons that went through all this training, and then find that very, very easily there.
I'm telling you, after this episode, they're going to be looking for it. So
yeah, that's right. That's right. No, I'm gonna call the CEO, Dr. Patino. He's a great guy. So I'm the president. He's the CEO. So I think I'm gonna call him right after this to make sure we put that up on the website.
Yeah, that would be awesome, because part of educating, and when women start looking, they want to find what we're talking about near them. So a surgeon who would be certified in ultrasound, they're gonna want to find somebody near them if they can. Okay, so
and if not, come to Miami.
If not, go see Dr. Earle in Miami. So before I let you go, I asked some of the fun facts about you. And one of the questions was, what would you be doing if you weren't a plastic surgeon? And your response is kind of funny. So an Olympian, a grill master, or riding horses?
Yeah. Well, actually, I guess I cheated a little bit, because 2 of those are related. So before I got into medicine and all that, I rode horses, and I would do jumping, so equestrian jumping, and I was really dedicated to it. I started when I was 7 years old, and I would do it 6 days a week, 2-3 hours a day for many, many years. So I guess I cheated a little bit, because I did go to the Olympics in '96. So
cool.
I represented Puerto Rico. I grew up in Puerto Rico, and Puerto Rico has its own Olympic team. So I went to Atlanta in '96, representing Puerto Rico for equestrian jumping.
How cool. That's so cool.
Yeah. But then I got into med school and everything else, and not enough time. And that's where I'm here today. But otherwise, I would have stuck to the horses, I think.
Well, that's one of the other questions. So why did you choose to become a plastic surgeon?
Right. So, I always loved the sciences, like basic as a high school student. But I wanted to do something with that, but I'm not in the lab. Like, I'm not wanting to stay in the lab. So medicine, and specifically surgery, is what I wanted to go into. But I didn't go straight into plastics. I started with general surgery. And when you do general surgery, you rotate through all the different subspecialties. And I finally got to my plastics rotation, and I noticed something which was really, really cool. So for most surgeries, you're actually destroying something because you're removing the offending organ, you're cutting off the limb, something is getting removed or destroyed. And you have to save the patient, basically, right? But plastics was the only one where you're putting things back together again, right? You're restoring form and function. And that's of course in reconstruction. But and then now that I've transitioned more to aesthetics and that too, right? We're trying to restore, the form, if you will, of what the patient was, before gaining a bunch of weight or before having, a few kids or simply just getting older. So we're trying to put things back. And I think that's what I really, really love about this specialty in particular.
And that leads me to my last question. Well, I have two more. Wait, I'm lying. One more. This one and then one more. I always ask the plastic surgeons that come on, what is their favorite procedure to do?
Yes. And I have two, and it's for very different reasons. So one of my favorite procedures is your straight breast augmentation. Why is that? Because it's fast. I can do it under 30 minutes. And it's very reproducible because it all depends on very specific measurements, right? So you get the measurements, it's very objective. Based on those measurements, you choose the implant, and the result is pretty much exactly what you expect. My other favorite surgery is the BBL. The BBL, I like it because it's really powerful. Like in some patients, you can really change the body, going from like very straight, like, SpongeBob SquarePants, like beautiful curves, hourglass shape. So it's a very powerful surgery. You can really, change the shape of the body. And it also allows for a bit more creativity, like because I like to make sure that I base that surgery on that patient's specific foundation. So each patient is unique. No two BBLs are alike. So I like that part of it. But what I find, I guess, challenging is that with the BBL, you can't always predict exactly how things are going to come out because there's so many variables that I can't control. And as someone who's a little OCD, that gets to me sometimes, but I can't control skin quality, for example, or fat quality. How much fat's actually going to take, how much fat's going to be absorbed. With the BBL, the post-op care is so important. So how compliant is the patient going to be? Are they going to do all their massages? Are they really not going to put any pressure on that buttock for 6 weeks? So all these factors come into play that I can't control, which sometimes, can make it a little bit more challenging.
Adds to the challenge.
That's right.
Okay, so before we go, I would love to hear from you, from both of you. If it was your sister, your mom having surgery, what is one word of advice that you would have for them before they embark on this journey or as they're on this journey?
I would say educate yourself thoroughly on the surgeon, on the procedure, on the practice, and on the journey. Empower yourself, make sure that you know what you're getting yourself into and commit to the journey because like I said before, it is a long journey. It's not, people have the misconception that they're going to just come into Miami, they have surgery one day, then go home the next day and everything's going to be normal. And that's not the case. It really takes months and it takes a lot of commitment. It takes commitment to prepare for surgery and it takes commitment to then after that do the best you can to make sure that you have the best results. So just educate yourself and empower yourself and through that journey.
With Dr. Earle.
Love it. Do you have any tips for our girls when they're doing their research into a facility? What's something that they should be checking out, looking for the facility that the surgeon's going to do surgery at? Or what should be tell me something that should be a red flag.
If the staff is in a bad mood, if the staff doesn't treat you well, if the staff just, there's something off. Like the surgeon may be great, but your experience isn't going to be great. So make sure that, when you call a place, you also talk to everybody else that's going to be part of your journey because the surgeon, yes, you're going to see him and he leads the team, but you're also going to see him less. You're going to see everybody else. So, just really for how the staff reacts to the surgeon, to the other staff, to the other patients. And, and then there's that accreditation, right? Like who is accrediting the practice? Who is overseeing that? Is it just a surgeon or is there another entity that's objective that it's also taking a look at how everybody's behaving, what protocols are following, et cetera, et cetera. So I definitely think those two things are very important for anybody looking to tele procedure.
I agree with you 100%. We talk about that all the time. If you're calling and they're not nice to you, that's the first impression. That's right. Exactly. That right there tells you a lot.
Exactly. And sometimes it may not be that they don't treat you right, but it may be that it's just not a good fit. They just, they don't align with you. And that's maybe not a red flag, but maybe that's a reason why you really want to consider other options.
I agree.
People may forget, what you said or even what you did, but they're never going to forget how you made them feel. And that's what we really want. We want every level here at Pure, from the first phone call you make to like the MA, to everyone, to like make sure that you're feeling welcome, that you're feeling, educated, that we're communicating with you. And that's really what it's all about, to create, a great experience, from beginning to end.
To happen, for the patients to feel happy, our staff needs to feel happy. So we spend a lot of time and effort in also making sure that our staff is rewarded and feels proud of working here as well. That's very important to us.
Love that. I've talked to Daniela and she seems very happy.
Right.
Okay, Dr. Earle. So if my girls want to come see you, how can they find you?
All right. So, well, the easiest way is just to go to our website. So you can go to www.pureplasticsurgery.com. And then there's going to be a button there that says virtual consultation. And that's the easiest, most effective way to kind of reach out to us. Once you send that in, our coordinators will take over and they'll, hold their hand as we talked about the rest of the way. But please, but in terms of, remember, we still have a lot of educational content out there as well. So, please, find me also on Instagram at, dr.alex.earle. And we're also on YouTube, Pure Plastic Surgery as well, with a lot of educational material on there, which will help you not just coming to us, but, doesn't matter, wherever you end up going. A lot of good educational content.
We love education. So go check him out on Instagram. Go follow their channel on YouTube. And if you want to book an appointment with him, go straight to his website, fill out the virtual consultation, and they'll get you right. How far booked out are you, Dr. Earle? Because these girls are going to want to come. They want surgery tomorrow.
Right. We're booked about 2 months out. But I was just announcing today, I opened up a couple more days in July. So for those that really want to get on there, that would be the soonest because we're pretty booked after that. So if you want to get in on the summer, you can call in about the July opening.
Sounds good. But just because you have surgery in the summer doesn't mean you're going to be ready for hot girl summer this summer.
No. They say hot girl summer starts in the winter.
I love that. Okay, I don't think we could have left on a better note. I will see you guys next week.
Thank you for having us. Bye.
Thank you so much.
Thank you.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.